Sanjana, Onco nutritionist from ZenOnco.io. Today we shall be speaking about anemia in cancer. So, what is meant by anemia? Anemia is a condition wherein the red blood cell count is below the normal count. So generally, when the red blood cells are less in count, so it means that the body is not getting enough of the oxygen. Anemia can occur in the cancer patients either due to the suppression of the bone marrow or when they due to the dysfunctioning of the kidneys as well. Bone marrow is wherein the red blood cells are produced, and in our kidney we also have an important hormone which is called as erythropoietin, which tells our body how much of the red blood cells need to be actually produced. But because of the underlying condition itself, or when the patient will undergo various treatments which are related to cancer, it can cause a bone marrow suppression, or it can also have a negative impact on the kidneys, and this can lead to anemia. What are the common signs of anemia which is there? The main common sign of the anemia is fatigue. Generally, a person will tend to feel fatigue. They will get frequent tiredness when they are experiencing anemia as well. And the common other symptoms are irregular heartbeat, pallor of the skin, difficulty in sleeping. You have trouble in concentrating as well. Earlier, that the red blood cells are produced mainly in the bone marrow, and because of the various treatments which a patient will undergo, they can experience anemia. Anemia can occur due to either treatment, it can be either treatment related, or it could be because of the patient related as well. So when I say this, the symptoms or the causes of the anemia are: one, it could be either chemotherapy and the drugs which are being taken. So when the patient will undergo chemotherapy, especially in patients who have leukemia or multiple myeloma or lymphoma, these patients do have a bone marrow suppression as well, wherein the bone marrow is not able to produce the required amount of the healthy red blood cells which are needed to be circulating oxygen in our body. Next is radiation therapy. Now, in patients who generally have leukemia or lymphoma or even multiple myeloma, they also undergo a radiation therapy during which the bone marrow activity is suppressed, and again they are not able to produce the healthy RBCs also. Next is nausea, vomiting, or diarrhea. Now, these are the common signs and the symptoms which we generally come across in the patients who have cancer. So, what happens is that when the patient is experiencing nausea, vomiting, or either diarrhea, there is a loss of nutrients as well. The nutrients which are generally lost are your vitamin B12 or even folic acid. Now, these two nutrients are also having an impact on the red blood cells also. In critical conditions, there could be too much of a blood loss which happens, and this is majorly seen when a patient is undergoing a major surgery or if they are having an internal bleeding as well. So, during these critical conditions, also they can experience anemia. Anemia in such a condition is called as anemia of the chronic illness. There are also certain medications which could lead to anemia, which are the common chemotherapeutic drugs. So it could either be vincristine or it could be even carboplatin. So these are some of the drugs which can also have an impact in reducing the iron levels in the body. It is very important to understand what are the guidelines for improving the iron levels in the body as well. Before we go into this, if you want to check your iron levels, it is important to undergo a CBC, which is a complete blood count, in understanding how much is hemoglobin levels in your body. Also, when the hemoglobin levels tend to go below 7, your doctor might also advise you to undergo a blood transfusion so that your iron levels can improve in the body. So now, what are some of the tips or what are some of the guidelines in how we can improve iron levels from the. So the thing is that there are certain foods which also have play an important role in improving our iron levels. Mainly, it is dependent upon the bioavailability of iron in the body and the capacity and the capability of the body to absorb this essential micronutrient. So first of all, you can include millets in your diet. So millets like ragi or bajra also have a good iron content in them. Green leafy vegetables like amaranth or spinach, fenugreek leaves have also shown to have good iron content in them. Also, you can include vitamin C rich foods. Vitamin C is a very important nutrient which helps in the enhanced absorption of iron. Rich sources of vitamin C include amla or orange. There is also your guava as well, orange and sweet lime. So these are some of the rich sources of vitamin C which you can also incorporate in your diet. Most important thing to remember is when we are taking iron and vitamin C rich foods, there are certain foods which can hinder the absorption of iron. So what are these anti-nutritional factors which are going to hinder the absorption of iron? Namely, it is one is calcium. So calcium is going to hinder the absorption of iron, and even tannins. Tannin is a compound which is present in tea or a coffee, and it can hinder the absorption of iron. So, to conclude, yes, anemia in cancer patients is a common sign and symptom which is generally seen. It is very important to understand and review the CBC as well in understanding how much is the hemoglobin level of a patient and give them timely intervention. Incorporating iron rich foods in the diet also is going to help in improving the iron levels gradually. And if you want to enhance the absorption of iron, it is also recommended to incorporate supplements along with the diet.